The leader of the opposition, Honorable Chastanet, recently decried what he perceives as the failures of Saint Lucia's healthcare system and the Health and Citizen Security Levy.
Mr. Speaker, are we better in health care? So you've paid $300 million more in taxes. Do any of us believe that the health care is better in this country? Well, the Medical and Dental Association said no. Are your roads better? Is national security better? In 2019, there were 46 homicides. Last year, there were 78. Do people feel safer? There's nowhere that you can see that life is better in Saint Lucia.
The Prime Minister, Honorable Pierre, answered this criticism by providing wider context to the House and the Saint Lucian public by recalling an initiative of the former Chastanet-led government, that is, to charge a fixed health insurance levy. And this is in stark contrast to the Health and Citizen Security Levy implemented by the Pierre-led administration, which excludes the basket of goods and services.
Cabinet took a decision to form a national health insurance levy. Cabinet to
Prime Minister,
levy.
you have 15 minutes left.
I don't need more time. A levy, form a national levy to draft recommendations towards the introduction of a financing levy that can provide health insurance to every citizen. Mr. Speaker, that committee provided a preliminary assessment to Cabinet in October 2019, and I wish to inform you of the following. A decision was taken to explore a fixed charge fee structure, which will be shared between the employee and the employer.
The Minister for Health, Honorable Jn Baptiste, laid out the ministry's plan to optimize the financing of and access to healthcare in Saint Lucia.
The proposed benefit plan will be structured into 3 tiers, Mr. Speaker. The first one will be government funded, providing essential healthcare services to most of the population with a focus on primary and secondary care, the essential package of health services. So, for example, cancer screening, dental services, eye care services, mental health services, nephrology, meaning kidney care services, and so on, breast cancer and that kind of thing. The second tier will involve a mix of private insurance employer contributions, government support, catering to individuals and families who can afford additional coverage. So there's a certain level that the government will cover. There's another level that if you want additional coverage, you can also participate in. And the third tier provides for complex and catastrophic healthcare needs, including overseas care when necessary. This will be supported by reinsurance mechanisms.
In sum, this amounts to another attempt by the opposition to detract and devalue the progress of the government and the healthcare providers all throughout Saint Lucia. It is hoped that as the country approaches elections, the opposition could be more accountable to the fact that fiscal policies cannot be in one instance convenient to their own governmental agenda, yet regarded as oppressive when implemented by the present Pierre-led administration. For Choice News Now, I am Cianna Dalsan.